Centering pregnancy is it's a different model of prenatal care where we follow like the same pattern of prenatal care. So like the same number of visits, and you're coming in and you're getting the same tests that are done and the same ultrasounds and the same kind of check-ins that are done. But it's in a model where we have time. We've got 2 hours with your nurse and your midwife to be able to go through more in-depth teaching and focus.
Breastfeeding reduces your baby's chances of developing allergies.
The rates of preterm birth and centering groups are lower. You've got kind of increased confidence. We've got more babies that are born at appropriate birth weights, so less like low birth weight babies, less triage visits because there's more knowledge and more communication with your providers.
There's a lot of like new information. There's a lot that we learn about our own bodies, and it's just not for the person who is like having the baby, but also for their respective partners. It could be your family member or anyone.
Centering is structured so that there are 10 sessions. What we teach them to do is we teach each person to take their own blood pressures, take their own weights. So they're learning how to track some of the basic things that we're looking at in pregnancy. So they become like owners of their healthcare. They'll have some time with the midwife or whichever healthcare provider they're working with in centering to do all of the baby checks, like doing the fundal height measurements, listening to baby, paying attention to baby's position and stuff. And then we sit down in a circle all together, and we've got different topics set up for each session. Do you know how many layers of clothing or blankets a baby should have on?
One more than you.
One more than what makes you comfortable. We bring in community speakers, so we'll have lactation consultants, we'll have doulas, physical therapists, pediatricians. We bring in people to kind of come in and share their knowledge to the people that will also be part of the care teams.
I have spoken to several family members and friends in other states, and I often see that this is something so unique to the triangle, and I just hope that anyone who is like having a baby has this level of knowledge and empowerment in their journey that I was able to get through centering.
That's one of the ways to really improve outcomes out there, is to get to know your clients, for them to get to know you, for them to realize that we're humans as well, and to have like trust builds open communication, and open communication makes sure that everybody feels like they're heard and that they're safe, and that we can navigate through things, whatever happens, together, and get to the end result that we're all looking for.